course, you need a proper fit and something that is tightly woven, that has a high thread count cotton or cotton blend. What's good can be a single layer mask or a low thread count. What's not recommended are knitted masks, masks with vents, folded bandanas that have a poor fit, unbreathable, or overly porous material. So, mask protection efficiency is very important. The most efficient masks are N95 masks, and then surgical masks, and then the FFP1 mask. And then you have carbon activated masks, cloth masks, and sponge masks. Okay? And you can see there the differences that they have in terms of virus protection, bacterial protection, dust, and pollen. And you can see the benefits of the N95 mask and the surgical mask. And of course, these will vary in price and availability as well. Wearing a mask with the best fit, protection, and comfort for you, the N95 respirator mask is very important when worn correctly. Respiratory masks offer the highest level of protection and filter 95% of particles. The KN95 respirator mask can vary, and again, it's worn correctly, provides more protection than disposable masks. And of course, disposable masks, sometimes referred as surgical masks, offer more protection than cloth masks. And of course, cloth masks offers the least protection. And so the do's and don'ts of wearing masks, okay? Find the top side of the mask. Ensure the colored side faces outward. Place the metal piece or stiff edge over your nose. Cover your nose and your mouth and your chin with the mask. Adjust the mask to your face without leaving gaps on the sides. Avoid touching the mask. Remove the mask from behind your ears and head. Keep the mask away from you and surfaces while removing it. Discard the mask immediately after use, preferably into a closed bin. Wash your hands after discarding the mask and even sanitize your hands. Remember that the mask alone cannot protect you from COVID-19. Maintain at least 1 meter distance from others and wash your hands frequently. Okay? These are the don'ts when it comes to wearing masks. Don't pull it over your nose. Don't pull below your nose. Don't leave your chin exposed. Don't pull below the chin. Don't touch your mask. Don't wear loose masks. And don't wear a dirty or wet mask. Okay? And so, after going to an event or gathering, monitor your health. Wear a mask and stay the distance. Write down who you were with and where you went. Answer if the health department's calls. If you feel sick, stay at home. Call your health provider. Inform people who you were with. And again, this is for contact tracing. Hasn't been done all that much recently. However, getting vaccinated makes a difference here in terms of all of this. Again, if you feel sick, this would be a breakthrough infection if you've been vaccinated. And of course, this would result in mild disease as opposed to severe disease. Of course, wearing masks can be optional now in certain gatherings if you're vaccinated, fully vaccinated. In summary, health facilities should continue taking steps to prepare the COVID-19 cases, even if there are few cases within your community at this time. Advanced preparation will help to stop the spread of the disease and allow us to save more lives. Prioritize vaccinations and therapies for mild to moderate COVID-19 disease and stay current on CDC mitigation strategies and recommended guidelines. Module 12, management of severe acute respiratory infections when it comes to COVID-19 infections is suspected. Okay. Acute respiratory distress syndrome, or ARDS, caused by COVID-19, the virus that causes COVID-19, okay? SARS-CoV-2. And so what you can see here is a plan of action if a person is suspected of having SARS-CoV-2. This would vary from one hospital setting to another based upon their routine procedures, okay? And you can look that over at your convenience. The learning objectives after this module, you should be able to understand the management of severe acute respiratory infections when COVID-19 is suspected, properly manage patients with COVID-19 and SARIs, understand when to refer patients to higher level care. Okay? When we look at acute respiratory distress, we can have a number of contributing factors: aspiration, severe sepsis, infection, hemorrhage, and shock. And this can come from a number of different sources, including infectious diseases. The pathological findings in the lungs can be acute, subacute, or chronic. That includes, in terms of acute phase disease, interstitial and alveolar edema, accumulation of neutrophils, macrophages, and red blood cells in the alveoli, and endothelial and epithelial injury. In the subacute phase of ARDS, you can have reabsorption of edema, signs of repairing, infiltration of fibroblasts, and collagen deposition. In the chronic phase, you have monocyte infiltration, you have increased fibrosis, epithelial repair, signs of resolution of acute neutrophilic infiltration. Respiratory disease in the form of pneumonia, and again, introduction, causes, signs, symptoms, diagnostic tests, and management and treatment of respiratory diseases are very important in a clinical setting. The main symptoms of pneumonia here that can be life-threatening in a COVID-19 patient is the high fever, chills, and of course, lung involvement that includes coughing, and shortness of breath, and chest pains. And again, in these individuals, you can have people developing low blood pressure, high heart rate, nausea, vomiting, muscular aches, and joint pain. So you can have a previously healthy individual and an individual that has chronic lung disease. And again, these individuals can be asymptomatic if acquiring SARS-CoV-2. Those individuals that have chronic lung disease can develop a more severe disease over time if infected with SARS-CoV-2 that leads to coughing, shortness of breath, and ARDS that can result in death. And again, ARDS, or acute respiratory distress, is a type of lung failure that can be life-threatening. So there are a number of extrapulmonary manifestations of COVID-19, and that is COVID-19 disease that are outside of lung disease that are associated with life-threatening consequences of COVID-19. And so you can have neurological disease, you can have renal disease, hepatic disease, gastrointestinal disease, you can have rashes of all sorts, endocrine dysfunction, cardiac disease, and thromboembolisms associated with COVID-19. Remember, as I said before, many different organ systems express the ACE2 protein that allows the initiation of infection by SARS-CoV-2, and you can have systemic involvement from this infection. In terms of pulmonary disease and increased risk for the most severe symptoms of COVID-19, this is SARS-CoV-2 infection in those individuals that may or may not have pulmonary underlying conditions. And what I mean by that, COPD, current smokers, people with interstitial lung disease, or asthma. And again, in those individuals, you're likely to see, after severe SARS-CoV-2 disease, you will see vascular permeability, alveolar edema. You could have clinical presentation of pneumonia, and of course, lung dysfunction that can be seen by X-ray analysis, infiltration of monocytes and lymphocytes into the infected areas. A person that is a current smoker, has COPD, they have been able to see increased expression of the ACE2 protein on alveolar epithelial cells. That can lead to increased virus infection, increased viral loads. And of course, when the virus infects the lower lung, it can infect alveolar type 2 pneumocytes that can lead to inflammation, vascular leakage, and pulmonary emboli. When there's serious alveolar damage and dysfunction, you can have vascular leakage, pulmonary emboli, and poor gas exchange. This can result in respiratory failure or ARDS, resulting in septic shock and multiple organ dysfunction and failure. In those patients, it's required that mechanical ventilation is important, and of course, there can be recovery from lung injury or that individual will not survive. In this case, in the lung, they've been able to show that the lung tissue expressed the ACE2 protein for virus attachment and infection. In this case, SARS-CoV-2 and alveolar injury, there's two sides here. On one side, you see resident alveolar macrophages and type 2 pneumocytes doing their job in functional alveoli. And on the right side, what you see is SARS-CoV-2 infection, the release of pro-inflammatory cytokines, reactive oxygen species, cellular debris, and over time, if enough alveolar involvement and destruction and damage occurs, you will get compromised oxygen exchange by way of pulmonary capillaries, leading to respiratory distress that can be life-threatening in those patients. The pathophysiology of SARS-CoV-2 from the lung has implications for other organ systems that can result in muscular pain and fatigue, loss of taste and smell, cardiac dysfunction, acute respiratory distress, and along with dysfunctions in the lung and breathing capacity and oxygen exchange in those patients that will require some type of mechanical ventilation to allow recovery of lung tissue. And if that doesn't happen, then that individual is unlikely to survive. And so these are conditions that can also result after COVID-19 recovery, resulting in the possibility of developing long COVID over time with lingering effects of COVID-19 that can last for 12 weeks or more. So the lasting impact of COVID-19, even those people that survive mild disease, okay, that is ranging health issues for 6 months or more, many of them will have long-term complications of COVID-19 that can last for years. And the idea is that they can have mental health conditions, nervous system conditions, metabolic and endocrine problems, gastrointestinal problems, skin disorders, blood clots that can last a long time, general fatigue, kidney disease, joint pain, respiratory disease, and cardiovascular complications to COVID. So all of these things can last in patients that have recovered from COVID-19. And again, this can be part of the post-COVID syndrome that leads to long COVID. And so, infection and prevention and control here, the chain of transmission. So you have susceptible hosts. This can be a person that has underlying medical conditions. This can be vulnerable populations. This could be a person that's older. This can be a person that has a suppressed immune system. Then you have an infectious agent. Then over time you build a reservoir. And of course you have a portal of exit. Then the modes of transmission for COVID can be something very general, like handshaking, sneezing, coughing, and so forth. And then of course a portal of transmission. So the chain of transmission for COVID-19 would be a susceptible host, a virus infection. The reservoir would be those individuals that are infected that are unvaccinated. And then the portals of entry would be the T-zone, the eyes, nose, and the mouth. The modes of transmission would be coughing, sneezing, singing, shaking hands, touching a fomite surface that's contaminated with the virus, and of course, many portals of entry as well. That includes the T-zone, and again, transmitted to more susceptible hosts. And in this case, anybody. And of course, depending upon the susceptible host, the underlying conditions, the severity of the disease will follow. Okay? And so this is a Lancet adaptation of COVID-19 triage strategy for low-income settings. And the idea, this is how some patients are processed in the hospital. And again, they are going to be screened. You're going to look for fevers. You're going to look for if they test positive for COVID, if they're high risk or low risk, if you're able to take a nasal swab and you're able to determine if they're positive or not, you're able to confirm COVID-19, then you would admit that patient to a ward, or if they swab negative, then that patient would be released, or you would repeat the swab days afterwards to make sure that you're not missing an early infection. And of course, in this case, you have airborne transmission, anatomized transmission that can lead to droplets on a surface. That contact surface can lead to transmission if somebody touches it and contaminates themselves and shake hands or touch their eyes, nose, or mouth. You have viral shedding that can lead to coughing, sneezing, and transmission of infectious agents through droplet nuclei. You have the settling of objects on a contaminated surface, dispersion in the air, and a continuous respiratory deposition by nasal breathing. So just breathing hard can disperse particles that can be transmitted from one person to the next. And of course, we understand the importance of masks. If you have an infected or an asymptomatic person, and of course, if you have a mask on, you can see the difference in terms of the amount of droplet nuclei that is being deposited by sneezing, coughing, singing, and so forth. And that individual without a mask would experience maximum exposure. And of course, with a person that has a mask that's infected or asymptomatic, that you can see that the amount of virus that would be likely transmitted in droplet nuclei would be reduced considerably. And the person that is also having a mask would undergo minimum exposure compared to a person that does not have a mask. And of course, washing your hands, covering your mouth when you sneeze and cough, avoiding close contact, and seeking medical attention when appropriate, are mitigation strategies that we have to live by during this pandemic. And of course, adding vaccinations to this strategy is most important. COVID cases among pregnant women, and again, you can see that this changes. And of course, this is about pregnant women that are unvaccinated. Currently, we're talking about 47, 45% of pregnant women have been vaccinated for COVID-19. So there's a lot of work to be done. And I gave you the reasons why they're at higher risk, just because of their immune physiology that changes in order for them to support a semi-allogeneic fetus and the mother not rejecting the baby. Their immune system has to change. And during that time of change, it makes them more vulnerable to respiratory tract infections that can be problematic. And of course, pregnant women that get COVID that are unvaccinated have more severe disease. Many of them are symptomatic. Many of them may require hospitalization or ICU admissions because of it. So protect yourself with the vaccine. If you already had COVID, studies show that getting COVID vaccine after you recovered from COVID provides added protection for your immune system. Okay, so if you had a natural infection and after you recovered from that natural infection, getting the vaccine is still important for you. It provides added protection, and again, will heighten your immune response, increase your neutralizing antibody and T cell numbers to effectively protect you from another COVID infection or a COVID variant. And if you are reinfected, that reinfection usually results in mild disease or asymptomatic disease. Vaccines are a safe way to keep you from getting and spreading COVID-19. The vaccines will also help protect you from serious illness if you get reinfected. Summary: health providers should follow WHO and CDC guidelines when treating patients and refer patients with severe illness to high-level facilities for treatment. And again, please refer to the full WHO document and CDC guidelines. Clinical management of severe acute respiratory infection when novel coronavirus infection is suspected. Interim guidance of January 2020. For more details as needed, be sure to access updated information from websites from the CDC, the FDA, and the WHO to ensure that current best practices are implemented. This is our last module, Children and COVID-19. Learning objective after this module: you should be able to know, in general, how COVID-19 affects children, know underlying comorbidities that put children at higher risk for severe complications of COVID-19, understand the clinical management of children with symptoms of COVID-19, and understand and prioritize COVID-19 vaccinations for children 6 months and older. Okay. So, again, we stress social determinants of health, and it's no different for children. The social determinants of health that children are living under will be very important in how they will interact with the pandemic in terms of infection, transmissibility, protection by way of vaccinations, and so forth. And so, when you're talking about children, you're also talking about parents, because if you're talking about vaccinations, you're talking about interacting with parents to give them the information they need for them to consider vaccinating their children 6 months and older, at least 6 months to 18 years old, to 17. 18 years old can be vaccinated without parent consent. So, leading signs of symptoms of COVID-19 in children versus adults. And so we see less fever in children. Children tend to have a less of an inflammatory response to COVID infections. We see less coughing in children. We see less headaches. We see less sore throats, less body aches, and less shortness of breath. And so it turns out children in many ways fare better after COVID infections than adults in many different symptoms associated with COVID-19. So we still have symptoms that can be problematic in children. The common symptoms include fever, dry cough, and flu-like symptoms. The severe symptoms can be shortness of breath, chest pains, hemoptysis, crackles, and respiratory insufficiency. The complications of all of this, if this becomes a lower lung problem in children, which usually it does not, mostly children are asymptomatic for COVID-19, but some of them, depending on underlying health conditions, they can have more serious complications that can be life-threatening. And here we're talking about pneumonia, acute respiratory distress, cardiac injury, arrhythmias, septic shock, liver dysfunction, acute kidney injury, and multiple organ dysfunction. And so to protect children, it's very important that you help them develop the skills necessary to wear a mask and wear a mask properly, consistently. And we know it's difficult among children. Sometimes children will go to school and start trading masks with each other, or for that matter, wearing their masks on their heads. And so it has to be emphasized both by parents and teachers and faculty to make sure that children wear a mask consistently and properly if mask wearing is mandatory. And of course, avoid contact with sick people. And it's difficult for small children to do some of these things. So you have to be vigilant in terms of showing them that this is important. So, COVID risk in children. Children can be infected and transmit the COVID-19 virus. All children can be infected and die of COVID-19 disease. All children can develop long COVID. All children are with underlying conditions have a greater risk of more severe symptoms of COVID-19. And there's a number change here. Approximately 1,700 children, pediatric, have died of COVID-19. Children can be infected and transmit the COVID virus. However, children are at a lower risk of symptomatic disease associated with COVID-19. In general, most children are healthy and less likely to have underlying medical conditions that can put them at greater risk for severe COVID-19 complications. Children are less prone to develop extreme inflammatory responses, the so-called cytokine storm, to COVID-19 infections during acute phase disease. And children are less likely to develop lower lung pathology associated with severe COVID-19. And of course, the immune system of children are more primed constantly and are activated against incoming pathogens. Children have a greater capacity to regenerate alveolar epithelium as part of a recovery phase to COVID. Children express higher levels of ACE2 that has been shown to have protective effects against pulmonary capillary leakage and inflammation. And pre-existing cross-reactive antibodies against COVID-19 is more common in children than adults. Children lack immunosenescence. And this is a kind of condition in which there's deterioration of the immune system as you age, and you don't see that in children. Children have a higher level of melatonin that has been found to help support immune functions. And of course, children generally have higher numbers of gut bacteria that are protective against infections than adults. So this is all of what's said there on this slide in so many ways. And so when we look at the grim path of the 1 million people that have died of COVID-19, of this 1 million people here in the United States, about 1,700 of them have been children. And so you can see the changes that have occurred rapidly. March 2020, we had less than 500 people that had died of COVID-19. January 2021, almost 98,000 deaths. And then just going to September of 2021, we had another additional 56,084 deaths. And January, 65,385 deaths. So you can see it, cumulative deaths over time, resulting in more than nearly a million people dying of COVID-19 in the United States. And again, what you see is a number of surges that are there in the pink. So with those surges, you saw increased mortality due to COVID-19. And so what we saw in the early days of the pandemic, we saw that children only represented about 7% of COVID-19 cases in the US, 1% of hospitalizations, and less than 1% of COVID-19 deaths, according to the Kaiser Foundation study. But that changed with the Omicron variant. So hospitalizations in children with the Omicron variant is very different. It has increased substantially since then, particularly in children less than 4 years old and younger. We saw higher increases in hospitalizations. We also saw it in 5 to 11 and 12 to 17, but higher in very young children, and that's always a concern. So when we look at COVID-19, some children can get very sick. 3 in 10 had no underlying conditions, okay, and had to be hospitalized. 9 in 10 were unvaccinated, and 2 in 10 required ICU care. So what it's saying is that middle one there saying 9 in 10 were unvaccinated. What it says is that vaccination of children is very important. It's essential to drive these numbers down, okay? Increasing COVID-19 hospitalization among US children and adolescents since the rise of the Delta variant. You can see that hospitalizations among ages 0 to 4, 10 times increase. Hospitalization among unvaccinated adolescents, 10 times higher than fully vaccinated. Again, stressing the need that children of all ages need to be vaccinated, especially young, very young children. And so more kids in U.S. hospitals due to COVID-19. And again, this is 2021, 2022, 100,000 per 100,000 in the population. You can see that very young children are leading the way compared to 5 to 17-year-olds. And of course, with the new eligibility criteria for children 6 months to 5 years old, this would be very important that younger children be vaccinated. A number of comorbidities that qualify COVID-19 vaccinations. All of these comorbidities, many of them young children will have, they still can be vaccinated if they have them. If they've recovered from certain types of injuries, if they've had chronic respiratory diseases like asthma, sleep apnea, cardiovascular disease, kidney disease, cerebrovascular events, diabetes, neurological disease. Some of these are comorbidities for older people as well. That includes Alzheimer's disease, Parkinson's, epilepsy, seizures. And again, young children have epilepsy and seizures as well, and they can have hepatitis as well and so forth. But all of these individuals qualify to be vaccinated. So what I'm saying here is that you may have a number of underlying conditions, but they don't prevent you or make you ineligible for getting a COVID-19 vaccine. Comorbidities in children, there's many of them, and they can have genetic conditions, neurological conditions, tuberculosis, obesity, chronic respiratory illnesses, renal disease, and so on. But again, they should still be vaccinated even if they have these underlying comorbidities. Obesity can put children at great risk for severe disease associated with COVID-19. They can have respiratory dysfunction, comorbidities, and metabolic risk because they're obese. And again, all of this results in more severe disease course of COVID-19 for children that are obese. The outcomes of patients with COVID-19 with comorbidity status, you've seen it before. Hospitalizations, ICU admissions, and deaths. For those with underlying conditions, every category is higher if you get COVID-19 and you have underlying health conditions. So we've talked about this with children in terms of multi-system inflammatory syndrome, and again in the earlier parts of these modules. Again, this is the kind of disease that you see, and again, this is weeks after children have recovered from COVID-19, they can develop signs and symptoms associated with multi-inflammatory disease. They can have acute kidney injury and multi-system inflammatory disease as well, or it can be a part of that condition. Okay, and while children with multiple inflammatory disease may develop acute kidney injury, most cases they experience mild disease, most children, and then they quickly recover, and their outcome is and their prognosis is very good. So the rate of death in children rise rapidly in the U.S. with the Omicron variant here, and you can see here from September 2021, you had about 500 children that died of COVID-19. We move ahead to March, it's nearly 1,700 children in the U.S. that have died of COVID-19, according to the CDC. 5 reasons your child should get the vaccine. It'll allow them to stay in school. It'll allow reduce COVID-19 variants of children which are still reservoirs for infection because they haven't been vaccinated, but now vaccines are available to them now. It'll protect the kids from infection. Of course, anytime you get an infection, the likelihood of developing severe disease is there. The likelihood of developing post-COVID syndrome is also there. And of course, if you're infected, and even if you're asymptomatic as a child, you can spread that infection to a person that is vulnerable, that can lead to severe disease in that individual. You protect others from infection, and the benefits of vaccination outweigh the risk in children, hands down. So when we look at some of the common diseases that have been eradicated, I've said this before, many of these diseases are in children, And of course, the incidence of these diseases with the introduction of vaccines have been simply remarkable in terms of reducing the incidence of disease based on reported cases in the past. And so, vaccines in children have been safe and effective for decades. And in 1960, we had only 5 vaccines available to us in the United States: polio, smallpox, diphtheria, pertussis, and tetanus. And then in 1986, something happened, the so-called liability shield. Vaccine makers were granted 100% immunity from liability under the 1986 National Childhood Vaccine Act, Injury Act. Parents and consumers could not sue the vaccine companies when their products injured. Since then, the childhood vaccine schedules have increased significantly. So in 1983, we had 24 vaccines available to us. Many of them were boosters. Going to 2019, 74 vaccines. Many of them are influenza, because influenza is a yearly vaccination. Many of them are also boosters for children. But again, 74 vaccinations from birth to 18 years old in the United States over time. And again, the children that come back and complain about adverse events associated with vaccines, they are far and few. These vaccines have been safe and effective for decades, and they're mandatory if these children are going to school. Who should get vaccinated against COVID-19? Everyone ages 6 months and older. That's clear. Okay, that is the latest update in terms of eligibility for the COVID-19 vaccines. And again, this 6 months and older only applies to the Pfizer and Moderna vaccines. Vaccine safety data in African American children, there are side effects to the vaccines. But again, they're mild, usually pain at the site of injection, fatigue, headache, chills, muscle pain, fever, and joint pain. The benefits far outweigh the risk. Symptomatic COVID-19 cases, hospitalizations, ICU, and deaths happen in children. And so the vaccine is a clear benefit. There is some risk of myocarditis and pericarditis that I talked about, but again, this is highest in the second dose with the mRNA vaccines. Again, this is mild to moderate, and many of these children recover just fine. This increase in myocarditis and pericarditis associated with the second dose, the incidence is about 2.3 per 100,000, highest among young males. Okay, and it's mild to moderate. And of course, the boosters for adults and boosters for children are very important. And of course, we have boosters for children that we've seen many times: hepatitis A, B, influenza B, measles, tetanus, diphtheria, pertussis, varicella. These are all vaccinations that are also boosters for children. And of course, again, for teens and adults, you can also see boosters that are recommended as well. Again, the CDC eligibility for these for boosters right now is 5 years and older with the Pfizer vaccine. And of course, the CDC Advisory Committee on Immunization recommended booster shots to include all adults, and that age number now changes 5 years and older instead of 18 years and older to receive the Pfizer and Moderna vaccine. So that's a change from 18 years to 5 years and older. Okay. Okay, and who should get the COVID-19? We've seen that. Mostly children and teens age 5 and older, 1 booster. Most adults under 50, 1 booster. Adults ages 50 and older, 2 boosters. And people 12 years and older who have a weakened immune system, 2 boosters. So this is the age and condition categories and the number of boosters that you should receive to be adequately boosted against COVID-19. The do's and don'ts for kids: do get children 5 years and older vaccinated as soon as possible. Children can get very sick from COVID. Talk to your children before vaccination about what to expect. Tell them the vaccinator, tell the vaccinator about their allergies and that your child has. Consult your child's doctor or another healthcare provider if you have questions or concerns. Enroll your child in a VSafe for personalized health check-ins following vaccinations. And remember to schedule your child's second dose and boosters so your child stay up to date on COVID vaccine. This is all important. Okay, rate of COVID-19 association, hospitalizations by vaccination status. And what you can see clearly is that if you're vaccinated, you stay out of the hospital, and if you're not, you stay in the hospital. Okay. More than 6 million children in the U.S. have gotten COVID-19. That number has increased. And of course, more than 1,700 children have died of COVID-19. That's a fairly accurate number currently. Many children will develop post-COVID syndrome. Many children have experienced reinfections and rebound infections with COVID. And many children have gotten severe multi-system inflammatory conditions and following COVID-19 diagnosis, which may have debilitating physical effects. And of course, children who haven't gotten COVID-19 have still been hit hard by the virus. More than 140,000 children have lost a parent or a caregiver, while long-term school closures and lockdowns negatively affected children over time in terms of their social interactions, emotional and mental health state. Across the board, children of color and those of lower income families have suffered disproportionately from the COVID pandemic. And so this is a clinical management for children suspected of having COVID-19. And you can see this will vary from one place to another in terms of the medical care facility. But if a child is expected of COVID, they have to then be screened to see if they're positive for COVID, and this could be done relatively quickly. If they have mild to moderate disease, they may be eligible for oral antivirals like Paxlovid. And again, the COVID-19 vaccine is very important. And again, monoclonal antibodies in certain age groups are also available. And again, depending upon if they're older, convalescent plasma, monoclonal antibodies, remdesivir, Paxlovid, or molnupiravir are all options for the children, and that depends upon their state of health, their clinical condition, their age, and what's available at that institution for children as a therapeutic intervention or a treatment option. Summary: children can be infected with COVID-19, spread the infection to others, develop severe symptoms, develop post-COVID syndrome, experience reinfections, and die from complications due to COVID-19. Children that get COVID are at low risk of symptomatic disease because of a number of protective factors not found in adults. However, children with underlying medical conditions can develop life-threatening disease, and children suspected of having COVID-19 should be managed appropriately, and the COVID-19 vaccine for children should be prioritized. I want to thank you for having me, and if you have any questions. So these